Hi, I'm Pete May, Director of Communications at Henry Ford Allegiance Health, and I'm rejoined by Dr. Vivek Kak, who is part of our infectious disease team here at the hospital. Dr. Kak, thank you again for your time.
Thank you. We're meeting too much.
We are meeting too much. We thank you for your time, though. There's a lot of questions that people have on their minds. We're hoping you can help us to answer some of them.
Sure.
One of the questions we're hearing a lot is, we have a lot of sick patients in the hospital already. What are we doing to keep them separated from patients who may be coming in with COVID-19?
Well, a couple of things. One, in the ER, if you have any symptoms that are of the respiratory nature and you're feverish, we're kind of triaging you away from the other patients. So we're kind of separating out patients who we think may be COVID or COVID exposed versus the other ER patients. So we are separating that traffic so that those patients are not intermingling. And then from the ER, if you get to the hospital and we think that you need admission, we are coming to this unit, which is on the 6th floor, which is a dedicated COVID unit. So we have the capacity to take care of at least 22 patients who may be tested for COVID even before the test comes back, and if the patient volume increases, we have the capacity to both go up and down this tower to increase our capacity to take care of COVID patients. So we are not intermingling patients who may have COVID versus the other patient population, so that at least from our perspective, we are not playing a part in spreading this disease.
Good to know. Some of us are learning a new acronym, which is PPE, and that stands for Personal Protective Equipment. What are we doing at the hospital to make sure we have enough for the anticipated number of patients coming in?
Well, the first thing is ensuring that the right patients and the right providers get the PPE. You'll see a lot in the markets that everybody is wearing masks and everything else. So that often leads to problems in the sense that you want to conserve resources for where it's maximally useful. That's what we are kind of focusing on, trying to conserve our resources so that we can use them judiciously. At the same time, we are trying and doing our best to try and get more and more of these resources from across the country, even across the world, so that if we never get into a place where we have to minimize our caregiver safety just because we don't have enough PPEs.
Now, Henry Ford Health System, which includes Henry Ford Allegiance Health, recently made the decision to cancel or postpone all non-essential appointments and procedures. What can you tell us about that? Why are we doing that? What should people know?
Well, part of it is obviously related to conserving resources. We want to be sure that those individuals who may require stuff like ventilators, like surgical supplies, we use them appropriately in the sense when we see or expect our surgeon patients. Right now, as you know, we've had only one positive patient in Jackson. That doesn't mean that there won't be any, especially since all around us the number of cases are increasing. So we will, and I expect to see a surge in our patients, and we just want to be ready for them now rather than decide 2 weeks later that we can't deal with them and cancel appointments at that point of time. Therefore, we are asking the providers to contact their patients to tell them these surgeries are being canceled. Now, if you feel that your procedure is not an elective one where it needs to happen, you and your provider can discuss. So it's not that we are making the decision without your input. So if you have a different opinion, you can talk to your provider, and they just have to talk to us and come up with a plan that this is medically necessary. The key is this medically necessary or not? And that's the most important thing. My definition of medical necessity, if I'm having pain, could be a lot different, but we want to be sure that across the system we are following guidelines that are consistent. And that's the most important thing. Sometimes what everybody hates is inconsistency, and we are consistent across the board.
Great. These are scary times. Obviously, people are concerned, they're worried. Some people have been asked to self-isolate or at least stay away and practice social distancing. What would you say to folks to try to reassure them during this time?
Well, think of this like a war. And from my reading of history, America has never lost a war yet. So we got to be confident that we'll do better with this one. We just have to follow the most important thing. Try and stay at home even when you don't want to stay at home. Minimize non-essential visits anywhere else. And as long as we follow that command and kind of listen to people who know more than us, we'll do well.
Great.
This is a time where healthcare individuals are under a lot of stress, but as I walked up and down these corridors, I can assure you that everyone's aim is to win this war, and I'm pretty sure we will.
And as we speak, I don't know if the microphone can pick this up, but we're hearing the nursery rhyme that plays whenever a baby is born in the hospital. So good things are happening here.
Life goes on. We will survive this too.
So what are you seeing here at the hospital that's going well? What are you seeing that gives you hope and encourages you?
I am one of the residency program directors, so I interact with a lot of the younger individuals, younger residents. And what I see is the feeling of hope and the drive in all of these individuals. Every one of the people I interact with, whether they are residents, janitors, nurses, everyone wants to do the best. And sometimes the joy of work and the fact that they want to do better is the most uplifting thing.
Sure. Everyone here is focused on defeating COVID-19, and we're all in this together.
Yep.
I want to share a few resources before we end our video. One of them is a list of closures at Henry Ford Allegiance Health. Dr. Kak, you mentioned that we have closed some locations, and I want to make sure people have information on that. If you go to our website at henryford.com/COVID-19 Jackson, there's a link on that page that will take you to a closures list. That information is changing daily, so please check back for regular information there. And of course, for all coronavirus or COVID-19 related news, you can go to henryford.com/coronavirus. Dr. Kak, thank you again for joining us.
Just one more plug.
Please.
I think if you have the capacity of being on the internet, this is a plug for getting onto MyChart. If you've never signed on to MyChart, sign up for MyChart, because that's one way you can get in touch with your primary care physician, with your specialist. Even though the clinics are shut down, the MyChart part is not shut down, and hopefully in the next few weeks, we will have a better capability of doing video visits. So I think I would use that as, if you have questions, that's one easy way of getting to your provider and they can answer back. So if you've had doubts, I don't know about internet, I don't want to see about it, this is the time to learn and get onto MyChart.
Great advice, thank you. So for Dr. Kak, we thank you for watching.
Thank you.